My name is Rama and I'll be moderating the second session for today. Firstly, let me introduce our speaker for the second session for today. So she's Associate Professor Dr. Nik Daliana binti Nik Farid. She is an Associate Professor and a Public Health Medicine Specialist at the Department of Social and Preventive Medicine. Prof. Nik Daliana also teaches Society, Behavior and Health and Health Promotion to postgraduate students, and has discovered the importance of social and behavioral science in public health. She believes behavioral and social sciences research helps predict, prevent, and manage diseases in individuals and whole populations. So with that, I would like to invite Prof. Nik to deliver her talk titled Building Empowered Communities Through Health Promotion, sharing from the program Aspirasi, Sihat. Prof. Nik, the floor is yours.
Thank you very much, Dr. Rama. Let me just share my screen. Thank you so much, Dr. Rama, for that kind introduction. To this morning, I would like to share about building empowered communities through health promotion. So this morning, I would like to share about a program that was held by our department in collaboration with Department of Public Health, or JKA UMMC. So this program is called Program Aspirasi Sihat. And before I proceed, I would like to acknowledge our Masters of Public Health students, as well as students who sat for our health promotion course last semester. Okay, so this will be the content of my presentation. So I will briefly talk about health promotion and also determinants of health. Then I will state 5 action areas of the Ottawa Charter for Health Promotion. And last but not least, I will demonstrate the running of the planning and also implementation of this program by applying the steps of health promotion program planning in community program. So health promotion is a process which enables people to increase control over and to improve their health. So it's not only focusing on individuals' behavior, but also it focuses on making changes on the social, environmental, and economic conditions in order to have an impact on the public and individual health. So these are basically the determinants of health. So it is the range of personal, social, economic, and environmental factors that determine the healthy life expectancy of individuals and populations. So health promotion is very much concerned with actions to address potentially modifiable determinants of health. For example, in terms of making changes on the individual factors like income, education, access to resources, education, employment, and so on. Also, in addition to that, access to appropriate health services and environmental determinants of health. So you can see that how health promotion basically is a process that enables people to increase control over the determinants of health. And also by doing this, it could eventually improve their health. And of course, participation is very, very important in sustaining a health promotion action. Meaning participation from the communities. So these are the 5 action areas of the Ottawa Charter for Health Promotion, of which they are very important when we want to strategize our community programs. So the first one is strengthen community action, develop personal skills, create supportive environment, reorient health services, as well as build healthy public policies, and enable, mediate, and also strategies play very important roles in any health promotion programs. So in public health, community programs are basically initiatives and interventions which are implemented at the community level to promote and address specific health issues. And at the same time, we want to improve the overall well-being of a particular community by engaging with the community members, organizations, also resources in activities that promote health, prevent diseases, and also address health disparities. Having a collaboration with other organizations, be it individuals, institutions, for example, healthcare, education, social services, is very, very important in order to strengthen any community programs. And of course, the focus when we do community programs is in empowering the communities. We want them to have an active role in their own health, and also by making sure that they are also involved in the planning and also decision making of the program. Okay, so now I would like to demonstrate how we actually run this program, Aspirasi Sihat, or PAS. So this is actually based on a generalized program planning model for health promotion program by Niger, McKenzie, and also Thackeray. So in this health promotion program planning, it involves 5 main steps, which are assessing the needs, setting goals and objectives, developing an intervention, implementing the intervention, and also evaluating the results. So based on that health promotion program planning, we adapted it and come up with this 8 steps in planning, implementing, and evaluating a community program. So basically, I will go through each step by demonstrating what we actually did in planning and also implementing the program Aspirasi Sihat. So the first step is to manage the planning process. So in this step, it is very important for us to identify the stakeholders, okay, make sure that they know what their roles are, and we also know what their expectations are. And we need to come up with a very clear timeline so that we can carry out all the activities within the time. And we have to identify the resource going to use the resources, and at the same time we need to gather data and do some analysis in order to justify this program. And of course we have to identify who will be responsible in making all the decisions. Okay, so it came to our attention of this news that actually came out, a research study that actually came out in the media, whereby the topic was on contributing factors to psychological distress, coping strategies, and help-seeking behaviors among adolescents living in the Klang Valley People's Housing Project, or PPR. So this study was carried out by Ministry of Health Malaysia and also United Nations Children's Fund, or UNICEF. So this study involves 37 PPRs, and also it involves more than 1,000 children and teenagers aged between 10 and 17. And in this study, they actually found that 13% of children and teenagers who live in PPR in the central region of Malaysia have suicidal thoughts or hurt themselves due to the pressures of life. And 12% have mental health problems such as depression and anxiety. Okay, so a meeting was actually called by the top management, and it was actually chaired by the Deputy Director of Clinical, that is Medicine from UMMC. And this meeting was actually attended by various experts from psychiatry, public health, and also family medicine specialists. So in this meeting, the department, basically our Master of Public Health students actually proposed a program to be held to address this important issue, which is adolescent mental health. Okay. But however, at the same time, we also proposed that other public health issues to be addressed as well, such as cancer, domestic violence, and also malnutrition for children, because they are all interrelated. So part of the planning also is to identify the stakeholders. So we have identified the internal and also external stakeholders. So the internal stakeholders are mainly the Jabatan Perusahaan Tertinggi PPUM, Public Health Department JKA, our department, and also Department of Corporate Relations. And we also have external stakeholders, of course, the NGOs, Pejabat Ahli Parlimen Luar Pantai, and also Persatuan Penduduk Bangsa Puri Puchera Ria. Okay, so we also identify the resources. So we have our manpower, who are basically our MPH students, who actually the main key players of this program, who helped in organizing this program. We have JKA, of course, PPUM, the community, DBKL, and also NGOs. The resources was this program was funded by PPUM, and of course the materials was gathered by our students and also from other departments as well. And in making the decision, the decision was mainly made by internal stakeholders, which are the Pejabat Timbalan Pengarah Klinikal, as well as together with the department and JKA. And as for the timeline, we need to run this program on the 17th of June 2023, and it was a half-day program. So in order to do that, we have to come up with a very strict timeline, whereby we need to make sure that all the activities and the people who are responsible to run all the activities will follow this specific timeline. Okay, so we started to plan since April, and the program was held in June. So the second step is to conduct a situational assessment. Okay, so this is a very important step, whereby we need to really justify this program and see what is actually the issue that is happening in PPR. Okay, so these are the 6 steps. So basically, it's about getting evidence, collecting data, and also to communicate this information and to consider this information in planning the program. Okay, so this is just an example of how situational analysis were actually done. So in the situational analysis, it was found that adolescents who live in PPR, aged 15 to 18, actually accounted for 51% of the 1,708 suicide cases reported from January 2019 to May 2021. And some of the factors which are associated with this mental health disorders among adolescents living in PPR were relationship issues, living environment, and also risky behaviors like smoking. Okay, so whenever we do a health promotion program, it often works well when we actually apply health behavior theories. So this is just an example showing one of the theories which were used, which is called social cognitive theory in addressing the mental health issues. So this involves looking at variables such as social, cognitive, and also personality. And another example of health behavior theory that was used is protection motivation theory, because we also considered we also addressed the issue of cancer, and we wanted to promote early cancer screening. So we've used this theory in terms of looking at their behavioral intention, and also what are their threats. So the third step is to set goals, objectives, and audiences. So in setting the objectives, it is very, very important to set objectives based on the SMART method, which is specific, measurable, attainable, relevant, and also time framed. And of course, with any program, there has to be one goal which can provide the overall direction of the program over a long period. Okay, so this is basically an example of the objectives which were set for the mental health component. Okay, so looking at the the goal is, of course, to reduce mental health disorders, suicidal and risky behaviors among adolescents. And the objectives were actually to improve their mental health awareness and to refer at least half of the adolescents who actually admitted to smoking to quit smoking clinic. Okay, so based on the Ottawa Charter, which I've mentioned before this, we've choose some of the strategies and activities based on this charter, like for example, developing personal skills, create supportive environments, and also advocate and also strengthen the community action. And as for the resources, we try to identify in terms of the funding and also manpower and also material based on whatever is needed through the strategies. So these are some of the examples of activities that I would like to share with all of you that was actually run during the program. One of the activities is treasure hunt. There was an activity called treasure hunt, and there were a few stations that were run by the MPH students. Okay, so one of it is also a station on smoking, and also in terms of we also collaborated with LPPKN, whereby they introduced this Cafe 18 program to the participants. And these are some of the strategies and also strategies which were actually built based on the Ottawa Charter, and as well as some of the resources that we managed to come up with, okay, in terms of human resources, funding, and also materials. Okay, and this is just an example of how we actually justified for the proposed budget. Okay, so this is actually not the total amount that was actually spent for this program. It was a bit more than that. Okay, so it is also very important for us to develop indicators in any program, and this is very important as evidence-based, and also it's very important so that we can actually do a continuous improvement based on whatever feedback that we get based on the data. And also this can be used as future program planning as well. And also if we want to prioritize any allocation of resources. And of course, it will also be used for any communication and future collaboration. Okay, so I just want to show how indicators can actually we can actually come up with indicators. So it has to be very specific. So it should tally with each objective, strategies, and also activities. For example, when the objective for cancer component is to address the issue of low awareness and stigma toward cancer, and the strategies is to develop personal skills. And one of the activities that were done is breast self-examination demonstration, or BSE, and the indicator that is set is to look at the percentage of female participants who know how to conduct BSE. And of course, the target is to increase the usage of BSE among female participants by 100%. So if you can see, it has to match, the indicators have to match from the start, that is from the objective. Okay, so of course we have to review whatever we have planned from time to time. So this is always being done with regular discussions with all the stakeholders which are involved. So the importance of reviewing the program that we are planning for is so that we can see whether the strategies that we have come up with will be effective in contributing to the goals and also objectives. And if we can see also whether it will contribute to the long-term objectives. And at the same time, we can see whether we have actually chosen the best activities to advance the strategy and see whether the activities are appropriate to the audiences. And of course, at the same time, to see whether the resources are adequate to implement the activities. Okay, so in implementing the intervention, there is actually no one best way for health promotion. For me, what is actually important is that whatever we do, it should be evidence-based, and it needs to be discussed with experts and also with the community themselves. So I would like to share, in my next slide is a video on the program. So I would like to share this video.
Saya, Profesor Madia Mas Ayu Said, Ketua Jabatan Kesihatan Awam, ingin merakamkan terima kasih kepada pelajar kesihatan awam yang menganjurkan program Aspirasi Sihat di Pangsapuri Putrajaya pagi ini.
Program Aspirasi Sihat adalah sebuah program outreach yang dirangka berdasarkan hasil kajian terkini.
Early detection is very important pada anda semua. Dapatkan mana-mana saringan kesihatan sama ada di hospital swasta ataupun hospital kerajaan berdekatan dengan kawasan anda. Perkongsian daripada Puan Kartini, pejuang kanser, dapat membuka mata penduduk untuk turun bersama-sama menyertai kita punya booth pada hari kami datang ke sini untuk membuka booth berkenaan memberi kesedaran kepada mereka mengenai kesihatan mental. Saya dengan rakan-rakan saya buka booth ini untuk terangkan pasal pemakanan. So apa tu pemakanan, kita nak promote makanan yang sihat kepada penduduk-penduduk. Kita buat pameran pendidikan tentang keganasan rumah tangga. So impact kepada penduduk-penduduk di sini adalah sangat positif lah. Saya tengok diorang punya sambutan tu sangat hangat. Dan kita ada banyak aktiviti yang kita target anak-anak kecil kita, remaja, orang dewasa dan juga warga emas untuk dapat kesedaran yang lebih lagi pasal isu kesihatan. So program ni kali pertama yang kita buat di kawasan PPR ini, dan kami berharap bahawa kita boleh buat lebih banyak program sebegini dan program ini dapat memberikan lebih banyak informasi dan boleh meningkatkan literasi kesihatan agar lebih ramai orang tahu kepentingan kesihatan secara menyeluruh. Saya amat berterima kasih, program ni diteruskanlah kerana banyak manfaat pada komuniti di sini.
Okay, so you can see in the video, there were actually more than 20 NGOs that we actually collaborated with, and we also invited Puan Kartini, who is actually a cancer survivor, who talked about the importance of early cancer screening. Okay, so these are some of the pictures taken during the program, and so one of the things that also attracted the committee was the health screening booths. So in the health screening booths, we had involvement from the district health office, which is PKD Lembah Pantai, who actually sent their health clinic staff who did screening to the community. We also had NGOs like, for example, National Cancer Society and NCSM, and who did screening for cancer for the community, as well as we have our Rabong from who also talked about the importance of early cancer screening as well. Okay, so it is also very, very important for us to do evaluation in any community program or health programs. So these are basically the 10 steps when we plan and implement a program evaluation. So I do not want to go through all these steps in this session. However, I just want to make a point just to highlight here that whatever programs that we do, having a valid data is very, very important. So data needs to be collected so that we actually know how we have made an improvement or how effective the program has been. So in conclusion, this Sihat actually from the community of apartment Putrajaya. So we had about 230 participants who gathered that day at our program. And I think we also have to thank the community, because from observation, the community themselves in apartment Putrajaya, they have a very strong bond. The social connectedness is very, very strong between them, and we managed to work together with them. Okay, and they also help with the pre-campaign, with the pre-program health promotion as well. And it's very important when we have this program, we mobilized our health experts and also healthcare services to the community. They were very appreciative, because for some of them, especially the elderly, they are unable to come to the hospital because of transportation problem, or because there's no family member to bring them in, and so on. So by mobilizing our experts in healthcare services to the community, they are able to get all these health services. And also we were able to make referrals as well to the nearest health centers. And with having this program, Aspirasi Sihat also has developed personal skills through personalized health education, and it creates a supportive environment through our linkages with the NGOs and health clinics. And last but not least, there is also a very overwhelming support from various stakeholders. So I think that's also one of the reasons why this program was also a success. We have a very good support from top management of UMMC, the Department of Public Health or JKA, our Public Relations Department, and of course the Persatuan Penduduk Putrajaya Lembah Pantai themselves. And I'm also happy to share that we have also managed to do follow-up programs with the community, of which we have been invited to run a program to address childhood malnutrition with the kindergarten children in one of the apartment, in one of the PPRs, which is near to apartment Putrajaya, which is Abdullah Hukum. Right. So that's all from me. Thank you very much.
Thank you very much, Prof. Nick, for the very insightful sharing on program Aspirasi Sihat. Firstly, I think from your talk, we cannot deny the importance of health promotion in empowering communities, especially as you mentioned, to actually address all the modifiable determinants of health itself, which is important. And I think secondly, I think from what you shared, we can see that although the program Aspirasi Sihat was only a half-day program, but the whole planning, implementation, I think the legwork before leading to the program there's a lot of work that has been put into it, involving various stakeholders, a lot of evidence-based planning in which you're identifying issues within the community itself before actually implementing an effective tailor-made intervention for that specific community. So congratulations to Prof. Nick and your team as well in implementing this program. So maybe we can open for questions. I think I see one question in the Q&A box from Prof. Nirmala. So the question from Prof. Nirmala is, so Prof. Nirmala mentioned that I strongly believe that behavioral factors are important predictors of both clinical and health outcomes. However, measuring these factors remain a challenge. It will be very useful for today's audience if you could provide some pointers on finding the right tools for measuring behavioral factors, particularly in special groups such as patients? Would you like to answer, Ravneet?
Okay, so I have to agree that it's not easy to measure the behavior of the participants once we have already run or carry out an intervention or health program. So it will take some time actually, although there are a lot of tools actually to measure the behavior, the changes in the behavior, let's say for example in terms of healthy eating, for example. Okay, so there are tools to measure the changes in how they actually practice their eating behavior. But then it will take some time actually to see the changes, and for changes to actually occur, and of course that is why one of the reasons why it is very important for any community health, for any health promotion. If we want to look at behavioral changes, it has to be we have to consider including health behavior theories, as I mentioned just now. So when we incorporate that, usually the health promotion program will actually work.
Thank you very much, Prof. Nick, for the answer. I'm just looking at the chat box as well for if there are any other questions. I don't see any other questions in the chat box or in the Q&A section as well. So I think if there are no further questions, we have come to the end of our session. So I'd like to thank all our audiences today for listening in to our session today, from both our colleagues from Orthopedic as well as the Department of Social and Preventive Medicine. So thank you everyone and have a nice day.
Thank you. Thank you, Dr. Rama. Thank you, everyone.